So this is example is a series of questions that we'll use it to answer about 6-7 questions. And this is typical what you're going to see, a very long question, a scenario. They're going to give you the situation where you are, and you have to pay attention to that area. That will determine your management, whether you're in the emergency room or whether in a clinic or whether you're on the ward. Pay attention to these places where they will provide you. A client presents to the pathology clinic, so the patient is in a pathology clinic. A client with a long-standing alcohol abuse. As you read through, highlight the clues that you're going to use, the buzzwords, that's what I call it, the buzzwords. So alcohol abuse, something should basically start, you should start thinking about something right now. Alcohol abuse, multiple admission for hematemesis. Present to the pathology clinic with complaint of increase in abdominal girth, weight gain, pruritus, fatigue, yellowing of the skin, stool and urine color now clay colored and tea colored, respectively. Deny IV drug use or multiple sexual partners. No prior blood transfusion. Find report of shortness of breath while going upstairs since he noticed increase in the abdominal girth. Excessive bleeding from small cut during shaving. He said, too much information. All I'm trying to get you to start thinking is all the signs and symptoms of a condition. I've listed about 10, 20. I've given you history of physical to help you distinguish between them. And then you can use that information to analyze it. So far, you should be thinking about somebody with the end-stage liver disease. I'm not done yet. We still have to look at the physical exams. ETOH abuse. That's what it does. Multiple admission to rehab. Plasma surgical history now, allergies now. These are his vitals. They look pretty normal. You take Tylenol for knee pain. Pay attention. And look at these abdominal exams. Softly distended, is non-tender. He has percussion fluid wave and large veins around the umbilicus. Physical exams for cirrhosis. This is capital medusa. This is ascites. This is what you expect them to have softly distended abdomen. And in rectum, they have large prolapse hemorrhoid. All these indicate portal hypertension. And their labs are pending. I provided you enough information to let you know that this patient has end-stage liver disease with a bunch of symptoms. Now, let's see what kind of questions we're going to do. They're going to do the same thing. Give you so much information. You don't know what question they're going to ask you, but just open your mind, extract the information that you need, and use it to answer the question. Don't go back to the question multiple times. All I know is patient with end-stage liver disease with signs and symptoms of end-stage liver disease. What question do you have for me? And this is the first question. First question said what? Which of the following the nurse should anticipate based on the presumptive diagnosis? And did not give you the diagnosis, but you have to make it. Select or apply. This is an extended type of select or apply. Okay, so we have end-stage liver disease. What do you expect? Low albumin? Yes, the liver makes protein. Therefore, if it's end-stage, albumin is going to be low. Your bilirubin is going to be high. It's cleared by the liver. Your platelet will be low because of portal hypertension. The spleen get bigger and the spleen suck all your platelet, and therefore platelet goes down. High PTT. This is a trap. You know, PTT is associated with heparin. And when you have liver disease, it's your PT and INR that is affected. Therefore, PTT is not related then. High ammonia. Yes, ammonia buildup and the liver cannot clear it up. And then normal AST, ALT, these are liver function tests. These are what we call LFTs. If your liver is cirrhosis or is end stage, your AST, ALT will be elevated. It's not as expected. You're going to have high level of AST. You're going to have high level of ammonia. You don't get any PTT. Your platelet is going to be low. Your bilirubin is going to be high. Your albumin is going to be low. So this is the way they will trap you. So we have low albumin, high bilirubin expected, high platelet is not expected, high PTT is not expected, high ammonia is expected, normal this thing is not, AST, ALT is not expected. Keep on trying to let you keep on thinking. Client condition wasn't, it was admitted for what? Confusion, sleepiness, disorientation, lethargy, and slurred speech. Signs and symptoms. People start paying attention to signs and symptoms for diagnosis. Confusion, sleepiness, disorientation, lethargy, and slurred speech in the patient with end-stage liver disease is what? Is known. The client has developed what? Stroke. It's not stroke. It's hepatic encephalopathy. It's not delirium. So hepatic encephalopathy. The nurse should anticipate in order to draw what? If you have hepatic encephalopathy, do you get a BMP, do you get a CBC, or you get ammonia? You get ammonia. You want to check ammonia level to confirm the diagnosis. And how you treat it, you give them omeprazole, lactulose, or sucralfate. You give them lactulose. So patient develop hepatic encephalopathy, withdrew an ammonia, and we treat it with lactulose. Now we're still going. All kind of questions you should expect. As the nurse prepared to administer the lactulose, which of the following are priority? Now these are your priority questions in the next generation type priority. You get regular priority question, but it is the same thing. Pharmacology priority question. If I'm going to give the patient lactulose, what should you all worry about? That is all the question is asking you. They've asked you multiple times in the old one, and the new one, they change it a little bit. You can get the same questions. Cardiac monitor. Why do I need a cardiac monitor? Lactulose causes low potassium, hypokalemia. So, yes, I should do that. Titrate to 4 bar movement. This is a bad priority. You want to titrate to 2 to 3 bar movement. So this is wrong. Assess for flapping tremor for an outstretched hand. Yes, you want to look for hysteresis. That's what it is. So this is good. Ensure client do not have constipation. Yes, the client is going to have bowel movement to clear the bilirubin and the encephalopathy, mostly ammonia. So they're going to have bowel movement to clear the ammonia that is causing the encephalopathy with the lactulose. Once again, the lactulose will cause them to have bowel movement to clear the ammonia. Therefore, if they have constipation, it's a priority. So you got to make sure they have no constipation. That is a contraindication for giving lactulose. Administer medication with milk and fruit juice. Yes, it is bad, but you can give it to them with milk or fruit juice or empty stomach. So that's good. Administer rectally if patient cannot take pill. Yeah, there's a rectal form, and there's an oral form. So you can give it to them in the oral form. So these are the things you should be thinking. That's your priority. You get a cardiac monitor, you assess for flappy tremor of the outstretched hand, ensure that the client do not have constipation. Those are your priority. Administer the medication with milk and fruit juice. Administer rectally if patient cannot take pill. If they ask you to select one priority, yeah, then you have to check for outstretched hands that tell you that they are encephalopathy, it's getting better. This one is multiple priorities that you got to pay attention to before you give the medication. So that's very, very important. So, and then I take you to the table again, multiple SATA. This is what you should be expecting. The client asks the nurse, what are the possible etiology for the encephalopathy? Which teaching is appropriate? Now you want to know, why did I develop encephalopathy? What causes it? If I have end-stage liver disease, what will worsen my condition to develop encephalopathy? The key thing is to avoid infection, so this is appropriate. You should avoid high protein diet, which is appropriate. You cannot completely eliminate protein from your diet, but you should avoid high protein because you cannot break down ammonia. Avoid constipation. Yes. Then avoid what? Because constipation would prevent you from pooping the excessive ammonia out. Then avoid hyperkalemia. No, you should avoid hypo. So low potassium causes encephalopathy. So this teaching is not appropriate. GI bleeding. When you bleed, yeah, bleeding is almost the number one cause of encephalopathy, followed by, I think, infection. Any patient with end-stage liver disease, you should avoid GI bleed. Whenever they have GI bleed, they develop encephalopathy because of the excess ammonia and the buildup that will happen, and the hypovolemia that causes by bleeding. So this is the next one is hypovolemia. So avoid hypovolemia that can also causes encephalopathy. So those are the signs and symptoms of etiology, what causes encephalopathy. So then we continue. All kind of questions that you should expect in a cirrhosis. I'm just giving you every areas that they will try to attack you. So when you study, you learn. This lecture just give you everything you need to know about cirrhosis. Patient eventually became more short of breath, right? With ambulation. Which of the following intervention the nurse should anticipate? When patients walk now, they are more short of breath. What do you think? They get short of breath because their belly is distended, right? And their diaphragm is here. It's being pushed by their belly, so the abdomen, and therefore they have shortness of breath due to ascites. And I want you to select four. Treatment for this shortness of breath due to ascites will be what? Paracentesis. Put a needle there and drain some fluid. But because you're going to drain some fluid, you need to replace the fluid because that's part of their body fluid status. And therefore, you give them albumin. This will keep fluid in the intravascular space, not in their abdomen. So you give them albumin. Then you give them laces, furosemide to pee it out. So they increase their urine output and they pee it out. Then because laces is going to cause hypokalemia, you need to help with the spironolactone. That will also let them retain potassium. But this is also will let them get rid of the fluid. So the best choice for ascites medically management is furosemide and IV and oral spironolactone, which is potassium sparing. If you give them normal saline, they're going to leak it out into their abdomen. You want to give them albumin. So this is wrong. Hydrochlorothiazide is not a treatment of choice because it will give you more hypokalemia, and we need to give them some. We're already giving them IV furosemide. Hypokalemia, hydrochlorothiazide is not used for treatment for this. So you use IV furosemide and oral spironolactone for the treatment of ascites. So this patient developed ascites. But you have to make a clinical diagnosis. It's becoming more shortness of breath when he's walking. It's secondary to, it's not a lung problem actually. It's just ascites that because that's what he was complaining about from the beginning. Now symptoms are getting worse, so we got to manage it. And then finally, they said what? Patient bilirubin continued to increase, and a pruritus became unbearable. Can't take it anymore. Which teaching below is appropriate? So now you're treating the pruritus due to increasing bilirubin. That's the side effect. Is that the idea is to prevent them from causing infection of the skin because they have liver disease. They cannot heal. So if their fingernails is long, they scratch this in this pruritus is painful. So they scratch until they get relief, but the scratching worsen it. So what happens, they end up cutting their skin and it will not heal. They get skin infection, staph infection. So you let them wear a cotton gloves, and when they're scratching, they don't feel it. They take shower and bath using a tepid, not cold nor warm, but in between, twice a day to moisturize the skin. We cut their fingernails short, not long, to avoid injury. They should use moisturizing, non moisturizing cream for the intact skin. They should wear cotton gloves, no polyester gloves. They should respect what? Clay, clay colored stool due to the bilirubin, not green. I know this is a trap. They can drink 2 to 3 liters of water a day. This will increase their fluid, but what? They have ascites. This is going to worsen their ascites. It will not affect their bilirubin. Therefore, this is not expected and then not a good teaching. And this is everything you need to know about cirrhosis. The summary of the signs and symptoms, treatment, management, lab work. As you prepare, pay attention to this. You take a disease process and you break it down. If we're talking about heart failure, you should pay attention to all the signs and symptoms, how to treat them. You already know it, but now they'll put it in the form that is not familiar with you. But just try to set the example. Like, start from the beginning. Somebody with a heart failure, how do you work it through? The same thing. Somebody with ascites, you work through all the problems that will happen, and you'll be successful. Take care of yourself, and good luck with exams.